breakout session. Thank you, Emily. We'll get into our breakout groups and we'll keep things moving forward with some of the things that we've been talking about pushing forward in a tangible way as a group. We have a few community announcements. For those that we messaged earlier that share out community announcements, if you have something that you want to share, please message Emily. She can include it in the email that goes out to the collaborative so that we have everything. I know where, even though we have an hour and a half, it always feels like there's not enough time. The other thing that you can do if you don't want to do that is feel free to go ahead and do that right through Slack. Shout out to Joe Prickett. Thank you so much for doing that through Slack on the Food is Medicine work group. So excited to see some traction there. All right, what did we do in June? Okay, so we started some data collection discussions, both with managed care plans, enhanced care management providers, and community support providers, and other stakeholders in the community. We are linking those to what we call our measurement strategy, but really measuring data or finding ways that we can look at data to kind of support our overall aim, or to use that data to help inform success or opportunities to maybe pivot in a different direction. Last Monday, believe it or not, although it feels like a lifetime ago, we talked about assets and barriers as a different way to kind of think through those really content-heavy Google Sheets that we've been working on as a group. What's blocking us from moving these things forward? What are some things that exist in the community that we could sort of lean on in order to move those things forward? All right, then fast forward to where we are today. Just a reminder always why we're here. We're here to talk about CalAIM, a subset of CalAIM in particular with regards to enhanced care management and community supports. We often talk about the nitty-gritty, the operational stuff, the systems-wide stuff, but really remembering the members and the beneficiaries and the people that we all serve in order to make these changes and to improve the overall experience of citizens across the state, but in San Diego in particular. Okay. I'm going to go through really quick some of the updates that were just published around enhanced care management and community supports. These are the policy updates. We'll share some information with you in the Slack today. We'll also send that out. But in addition to kind of going through this really high level, we're also going to work to kind of condense and put together, for lack of a better term, a cheat sheet or a Cliff Note version of all of these different things that are yeah, citizens or residents. I don't know, Kathleen, which would you say? Is it residents?
Considering that we serve non-citizens, I think residents is
That's
more
a really
sensitive.
great point.
Yeah.
That's a really great point.
Me being one of them. I am not a US citizen.
I've mental note, and moving forward, I'll say residents. It's interesting, a sidebar we can talk about another time, but it's interesting how we don't think about sometimes the language that we use and who it could potentially exclude. So I appreciate that. Absolutely. So really quick, big picture. And again, like I said, we're going to share a bunch of links with you all. We're also going to work to kind of condense things and share back out with you all a cheat sheet or a Cliff Note version of all of the different enhanced care management and community support updates. All right, so the first that we'll look at is the eligibility and authorization changes. So the eligibility and authorization changes in the ECM and community support policy updates are listed here. I'll call a few out, that there's some changes in previously approved restrictions on community supports population that are slated for January. There are also some changes that are sort of effective immediately around imposing any additional eligibility requirements for authorized ECM services. So the ones that exist today may still exist, with the goal to move them forward and align across the state. But at present, there'll be no new additional eligibility requirements for ECM services beyond what is in DHCS established criteria. Authorization, standardized authorization and reauthorization periods for ECM across the state, and working towards a standardized authorization and reauthorization period for community support. So some things have been substantiated already for enhanced care management. DHCS is still working and probably will over the next month and into the early fall on standardized authorization and reauthorization periods for community supports. And then the other one is that DHCS is strongly encouraging MCPs to implement presumptive authorization for recuperative care and short-term post-hospitalization. Just shouting that out because I know that it's been a topic of some of our conversations in our work groups. And then the next batch of changes have to do with referrals and contracting. Danny, anything to add before I move forward?
I just added in the chat a little bit of context, just taking one step back, that these changes are coming from DHCS based on feedback that they've heard from a number of different places. So stakeholder advisory groups, listening sessions, interviews, etc. CPI collaborative. So we have kind of an open line to DHCS talking about some of the challenges that you all are experiencing. So they've taken all of that data and they've figured out what are some of the key changes that need to happen. What you see here today is meant to start a conversation about some of these policy updates, but it's not an exhaustive list. So I definitely recommend you to go look both at the policy guides, depending on if you're an ECM or a community support provider. And then that PowerPoint that was linked has an update of highlights a lot of the updates within the policy guide. So you have it in one spot. So definitely go and look there. And as Denise said, we're trying to digest this information and figure out what are the key takeaways for you all and how does it apply to the local context in San Diego. So more to be coming there as we're kind of figuring out what this looks like locally for you. Good news is that a lot of these changes are reflective of a lot of the challenging conversations or the conversations about challenges that we've been having in CPI, which I think will be part of the conversation today of, do any of these changes change some of the areas of focus or the ideas that we had? Do we want to focus on them still? So good news is that DHCS is really trying to be responsive and really trying to figure out a way to help support implementation of community support in ECM. And then overall context, more to come, but definitely reach out to us if you have questions, if there are concerns or other challenges that you want us to hear as we're having conversations with DHCS and otherwise. You can do that via Slack, via email, in chat, whatever works for you. So that's just kind of higher level context.
Thanks, Danny. Referrals and contracting. So 2 points to mention that DHCS will begin designing a statewide referral standard. So sometime in Q3. And then, expecting obviously that most referrals come from the community. This also ties to some of the things that we've been talking about in our breakout rooms. And then contracting as well, looking at prioritization of contracting with providers who specialize in specific populations of focus. And also really looking at the local landscape and the community-based organizations and other care providers that exist locally. The other thing that we wanted to kind of touch on is billing and documentation of services. So a couple of things here tied to the ECM and community support's use of provider portal for day-to-day documentation of services. So The requirements will be lifted. I think that there'll still be things that make the portals more efficient or streamline some of the processes, and certainly from a reference materials and access. But there is the requirement which will be lifted. Another thing to kind of call out as related to that is MCPs absolutely can still use their own portals to exchange member engagement lists and authorization info. So when we think about PHI, especially protected health information, anything that's sort of sensitive there. The other one is ECM and community supports. Our services are subject to standard reimbursement timelines. So DHCS is really trying to work through standardization and consistency across the state to reinforce those existing timely provider payment requirements. Again, I know that I'm moving fast, but we will share all of this out with you, and we will work to kind of put things together in a document that's easily readable and works for the entirety of the ECM policy guides and community support guide. The other thing I want to touch on, because it's come up a few times in conversation and there's some material out there now, there's a great webinar and we'll share that if I know things are being shared via chat, but there's some nice resources that are available. I'll say just a few quick things that number one, DHCS and the managed care plans in San Diego are committed to ensuring that Medicare members do not experience disruption in service. And I think that that is really critical, that both DHCS obviously and the managed care plans in the community are making that commitment. The managed care plans are also working individually and in collaboration with one another on transition planning, and then we'll work with them to share information with you all as that comes out this fall. The other thing that I think is important to note is that members are considered part of a special population. So member authorizations for ECM will be honored across the prior managed care plan to the receiving managed care plan. And there's some nuances obviously with community support services, but for those that offer the same service, the intent is that that then transfers. And or if for whatever reason they don't offer that same community support service, that work will be done with them. DHCS obviously is strongly encouraging the receiving managed care plan to honor the prior managed care plan authorization. And last but not least is that there'll be a sort of that overlap gap period of time during the transition. And again, this isn't the be all end all information. This is just a start on where we're headed this fall. Okay, let's keep moving forward. We're going to get into our breakout rooms. Before we do, we have something that we wanted to kind of touch on as it relates to data collection. So there's a link here for you to complete a series of questions. There's just a few, and we're looking to collect that data across the CPI. We'll also share that with you in our email and in the Slack channel, but it's really meant to look at ways that we can sort of collect an inventory across the participants. And again, this ties to conversations that we've been having about really trying to substantiate baseline in and around specific categories. Okay, the next thing is that we're going to get into our breakout rooms. So we're going to try things a little different this month, and I'll mention a few things. So in effort to really try to move the group forward faster, we're trying to do some things to kind of really figure out some tangible things that we might be able to push forward collectively as a group. And thinking about that, what might be done in between meetings, right? So we know everybody is busy. We know that there's so many meetings and never enough time. We know that there's competing priorities for all of your time. So all of that to say, we'll do the best that we can, but really thinking about how can we create something that's tangible and move it forward, and then assess to see if we need to pivot to a different direction, or if we need to continue on that path and enhance or expand what we're testing as far as a change in our existing sort of ecosystem. That said, we're going to get into our breakout rooms. We're going to ask you all, you will be accompanied by a representative of Intrepid. But we're going to ask you to identify first who from the group is going to be sharing out. So we're not going to skimp out on group share this time, folks. So each member, each group will have a group representative who's going to share out at the end of this breakout session today. And that person, and in support of the group, obviously, is going to share one thing that the group is going to be focused on moving forward in the next 2 weeks. So we're going to get together. We're going to give you all sort of a visual to have an engaged discussion. And then we're going to come back and share as a group. After the group share, we do have a few community announcements that we want to hit before we close. And then that's it. Then everybody can go and have a happy rest of your Friday and weekend. So with that, I'm going to just pause before we break out. Anything to add from the Intrepid team? Any issues, questions from the group?
And also, again, just recognizing that we just kind of threw a lot at you very quickly. So if there are kind of really pressing questions, Janet, I see your hand raised. Thank you. Feel free to raise them either in chat or here, and we might take them offline and chat more. But let's just open it up really quick. Janet.
Yeah, this is Janet from Health Center Partners. I'm trying to go back and I remember, I thought it was Monday, but it was a week ago, Monday on July 17th was the coffee chat. And we did a different process. So there was a different document that we were working with in that session. I forgot the name of it and even who was heading it up. How does that tie into the Google Sheet and what we're doing today and with this group?
It's a great question, Janet. What we did, and you'll see sort of a visual, and actually, I don't know, Emily, are you still sharing screen? No. So each group will break out and there'll be a visual representation of that. So we'll reshare, it was in something called Miro, but we'll reshare that with you. But basically what we did was take that plus the information that is in the Google Sheet and some of the conversations that have been had thus far, either via email or in previous meetings. And then Emily, if you want to just advance one more slide. So we have a visual for the group. And then we're sort of taking that visual and sort of really trying to nail down next steps in a tangible way and move them forward. So making a decision about what we need to achieve by the end of today and what do we want to work towards in the next 30 days. Does that work for you, Janet?
I think so. So you said, well, one thing we're going to do a group share out that we want to accomplish in the next 2 weeks, but this is a little bit different timeline. Are there kind of two different things really happening?
I think that the idea is to get the group to start a plan
Moving. Okay.
for the next while,
Okay.
but the commitment on the group share is to really be able to verbalize something that one thing that you're going to be actively working on.
Okay. Thanks.
Absolutely.
And really quickly, kind of just one more time to reframe the connection between the coffee chat and then this. The coffee chat was really to take a step back and look collectively across the breakout groups and kind of reshuffle some of the participants looking at each of the different challenges or issues to, one, ensure that there's transparency across, because the last thing that we want to do by continuing to have these breakout sessions, each of these meetings, is to create silos. We acknowledge that there's a lot of people working in a lot of spaces right now, and we want to continue to do this Zoom in, Zoom out, so we can all see what we're working on. Happy to hear feedback on that of other ways to continue to increase that transparency. But at the coffee chat, we kind of zoomed out, looked across what are the issues that we're focusing on, and then shuffled the breakout rooms to refocus on that. And then, as Denise said, we're bringing that context into the conversation today to get back in the monthly breakout rooms, or the breakout rooms we've been doing in these monthly meetings, to continue the conversation about next steps. So it has been a little bit of zooming out, zooming in, to try to just kind of turn the coin and look at it from different angles, and also increase transparency across the different breakout rooms to try to decrease silos.
Okay, folks, I know you're super excited. We're gonna break you out into your rooms. If you don't remember which room you were in before, you can self-select. We also can tell you because we put that on the Google Sheet.
And if folks can't see the choices for rooms, just go to your Zoom control bar and you should see a little square that says breakout rooms, or click on the 3 little dots that says more, and then you should be able to see breakout rooms from there to make your decision.
There's never enough time.
Never.
I know that always feels like that's the case. So what I'm going to try to do is I'm going to try to keep us moving forward and do what we said we were going to do, which is a group share. I'm going to call on my group first, because I think that we were awesome, even though that we're all coming from different directions and different points of view. I feel like there's a couple of things that are tangible that we plan on moving forward. And with that, I'm going to hand the mic to Leanne.
Hi, all. So our group was focused on, I didn't get the top heading, but basically we're focusing on community access to ECM and CS resources. So clients knowing what's out there, and also providers knowing what other, where to refer for different CS services. So one thing we mainly focused on the 211 database, kind of how they have the one side that's CalAIM specific, but then also just within their database that people can search for CalAIM services. So overarching theme is working with 211 to streamline and enhance the ECM and CS information that's available, and also making sure that it's accurate. So one thing we want to focus on is getting a one-page guide from 211 about the best way to search on the website. I was in the meeting that we had yesterday, which falls on the fourth Thursday of every month. And Rox gave a really good kind of overview of the best way to find the information, the way that the database is set up, like on the information side. So we were hoping to get some sort of, one-page thing of like the best way to search for staff and also for clients. It's already there. Wow. See, this is why we needed a 211 person in our group. I wish we were talking about. And then our second kind of area that we wanted to focus on is how to make edits. So either to, CBO's listings, or how to make edits to the provider matrix that's on the special CalAIM side of the website. And then how quickly that information will be updated once we share that information. So a lot of our things are mainly just questions for 211. Joanna, you're on my screen. So
What we could do, Leanne, is maybe you and I can take point on getting a meeting scheduled with Joanna, and then we can kind of talk through some of the points of our conversation. And then I think the other thing that we mentioned is getting some feedback from users and maybe putting together a Slack poll, and we can come up with some 3 questions or so that we can Slack our CPI group.
Yep. And our last thing was just information about the current workflow for updating information, what that looks like.
Wonderful. Thank you so much for being so brave. Next group representative.
I actually am it relates to that last conversation. So I'm gonna pitch it over to Julie for a second and to share just a little bit of about the conversation that we were having in terms of bigger picture perspective. And then we can talk about updates and next steps from this group.
Great. So my main contribution was to quote Don Berwick, relevant to initially patients or clients, and it goes much further than that. And that is nothing without me, about me without me. Or as we changed that in our group, nothing about us without us. I am a strategic planner by background and natural inclination. And I have always found that you need mixed groups to be working through these difficult process issues, all right? And it's one of the things that I find troubling about the way that the state approaches this. If only the plans are sitting with the state and they don't have the providers and the bennies present to hear and to share, you are not going to get what you want in the end. It is just as simple as that. And so to the degree locally, we can identify in the driver diagram and so forth, what the critical pieces are that we need to accomplish between now and the end of 2023. So 2024 is more successful. It's really important that the groups that we pull together have this cross-sector participation, all right? Sarah Legg was in my group and she made a really important point about, who within the organization are the people who can be involved, who have enough of the detailed knowledge and enough, authority, put that in quotes, that they can participate knowledgeably and influentially. That's key. And then to the degree that the plans can do the same thing. So each one knows, a small cadre of people who can work on this stuff, and we can make this happen together.
Thanks, Julie. And then just really quickly in terms of this breakout. So actually, before I do that, I think that should be our new mantra for CPI. So just saying we should pull it out and have that be kind of a guiding principle. In terms of this breakout, there are a couple of areas that we are exploring for moving forward with data standardization. So first, we'll continue to have a conversation with the managed care plans around some data elements that would enhance the amount of data that's in the CIE coming from the managed care plans. So those conversations will happen working with Sarah and Cami and others. And then also we are wanting to have some conversations potentially with the local FQHCs in light of the data exchange framework and the fact that the FQs are going to need to be sharing data a little bit more robustly come January of 2024. Now is the time to start the conversation around what does that look like locally. So Janet and I will connect offline about any support needs there. So those were the 2 kind of next steps.
Okay, we have 2 more group share outs. I know we're getting close to time. Can I hear from the next group?
I can go next. Hi, everyone. This is Joanna from 211. So I was part of the group, and let me just pull up the Google Docs. So the community collaboration and communication group, and I think the main focus of today's meeting was just related to the possibility of doing a community-wide led outreach event. So invite community members or Medi-Cal members to a CalAIM, learning session where they can learn about the different benefits that are now available through managed care plans. and then create an enrollment process for any members who might be interested. So we talked about the feasibility about that, you know, who would host it, who would kind of own that? Would it be, you know, a community-wide ownership of these events, you know, creating some consistency so that community-wide members know that, you know, the first Saturday or the first Monday of this month, they can come to these events where they can learn more and they can enroll in these services. So most of our conversation was regarding that and you know, who would own that, and how we would organize something like that. And then of course, you know, what the marketing strategy for that would be. So still kind of working through those details, but, you know, interested for the larger group to see if that's something that, you know, if providers would be interested in and who would want to collaborate on a community-wide effort like that.
Very cool. Thank you so much, Joanna, for sharing and for being the volunteer to share out. I know we have one more, so I'll be quick about it. Who is the next group share?
It was a fair, timely, and streamlined reimbursement. It was me and Chris. Hi, Chris. And basically we had a long conversation, and our next steps are to talk with potentially the MCPs to see if there is some sort of written or documented process for getting reimbursements. So that's it in a nutshell.
Awesome. Thank you so much, Emily. Appreciate it. Community announcements. I'm going to ask Heather and Lynn, if you don't mind. We have 4 minutes left. If you want to, if you think you can squeeze it in, then please feel free to come off of mute. Otherwise, if you want to send us some information in particular as it relates to justice involved in children and youth, we can make sure that we share it out with the collaborative as well.
Denise, I can just share it really quick. We have a Healthy San Diego Justice Involved Work Group meeting. It's the 3rd Wednesday of every month. And we're really trying to talk about, you know, ECM, the ECM network for the JI population, and the different CalAIM justice initiatives that are being implemented. So the next meeting is August 23rd from 1 to 2. And if anyone's interested, they can reach out and I'm happy to invite them. And then I don't know if I know there was an HMA Justice Involved webinar that I believe HealthNet put on, and there might be a next one. So I don't know if Kathleen wants to talk about that.
Yes, there was one. There will be another one. We have not yet gotten our deck through our legal and compliance in order to be able to release it broadly. But as soon as that triggers, then that will be also available for anyone to look at it, not in real time.
Thanks, Kathleen. Lynn, okay to share your contact information, then we'll just make sure that we include that. And then Kathleen, when that's available, please share. We can make sure that it gets out to the CPI group as well.
I think what I'll do is I'll share it with Lynn because she leads our county-wide effort. And then if that's can be the point of contact, I think that's the most efficient way.
Absolutely agree.
Thank you.
Sounds good.
Wonderful. Outside of that, Monday, we have the first of the CalAIM event series. So for those of you who are interested but haven't yet registered, you can register. We'll include that information again when we send out our email, but we have put registration information in the Slack channel as well. And we can talk a little bit more about this, but not today because we don't have enough time. But I just want to just close and say thank you for everyone. I know these aren't always easy conversations, and to try and put an anchor to some of the things that we're thinking about as a collective is difficult. So I appreciate you working to find something tangible to move forward, and we'll keep things moving forward as a result. So really appreciate you all spending the time today, and look forward to talking with you all soon.
Thanks, everyone. Have a wonderful Friday.
We'll stay on, or Danny, I know you have a conflict, but I'll stay on for a couple of minutes if anybody has any questions, issues, comments. We'll also send out a survey like we normally do.